Assalamu alaikum. The communication
Hello.
day. Yeah, wait, I will just read the scenario
Okay, okay,
please. Okay, the
okay.
communication day. The first scenario, you are the doctor in the diabetic clinic. It's explaining the problem, explaining the importance of the treatment. Mrs. Debbie White, 29 years old woman with newly diagnosed diabetes, who works as insurance company administrator. The scenario patient who had previously been well was admitted an emergency 2 weeks ago with the diabetic ketoacidosis. While on the ward, she was tough. She was taught to self-inject insulin and monitor her plasma glucose concentration by the diabetes specialist nurse. She was discharged on regular insulin and regular appropriate dose of insulin with arrangement to see the specialist nurse the following day. She missed the appointment and is now attending the outpatient clinic for the first time since discharge from hospital. It's clear for her glucose monitoring that the patient is having problem with the control of her diabetes. Some days her plasma glucose concentration are worrying low, while on other day they are very high. She admits that she hates having to inject herself and sometimes omits to do some so, but then the next time plucks up courage and injects an extra dose of insulin to compensate for the missed dose. The task is to explain to the patient essential principles of plasma glucose management in type 1 diabetes insulin dependent. You should also explain why she should try to maintain her plasma glucose concentration as near as possible. You should explore any difficulty patient has with coming no terms with her diagnosis and help her to find way the dealing with this. Okay, you can start now.
Hello, I am Dr. Muhammad. I am doctor in clinic today. I need to confirm Miss Debbie White, 29-year-old with me.
Yes, I'm Debbie.
Mm. How are you, Miss Debbie, now?
I'm okay, doctor.
We are today have meeting to discuss some health issue related to you. We will talk and address your concern, and all our talks will be confidential, okay?
Okay, doctor.
Firstly, Miss Debbie, how much do you know about your condition?
So doctor, I was okay before, but 2 weeks ago I was admitted to the hospital from the emergency department because they found out my blood sugar was very high and there is too much acid in my blood. So they gave me some medications and they diagnosed me with diabetes and they asked me to inject myself every day with insulin.
Sorry for that, Miss Debbie. And we are here to help you and to uh, update you for any concern that you want. And how are you now? You are okay now?
Doctor, I'm feeling better than before, but doctor, I have a real issue with this injecting myself for every day for the rest of my life. I really find this diagnosis very shocking. I cannot see myself doing this for the rest of my life.
I am sorry for that, Ms. DB. And your worries is valid for any patient has this new condition. But what do you expect from our meeting today?
I don't know, doctor. I want you to help me with this because, doctor, when I'm going out of friends, I have to check the menu. I have to order things without sugar. I cannot eat normally. I cannot live my life like before. This is very straining, doctor.
Yes, I appreciate your words, Mr. DB, and I know how much it is new for you. But let me firstly explain for you more and update you more about this new diagnosis for you, that diabetes, okay?
Okay, doctor.
Firstly, the diabetes mellitus, it is a condition when there is some lack of one important protein in your body called insulin. And I will draw for you, this is a gland in your abdomen called the pancreas. This is the one responsible for this protein, which is responsible for controlling your blood sugar after eating any meal. So that's why we prescribed for you that insulin to control your blood sugar instead of this deficient protein. You are with me, Miss Devi?
Yes, doctor, I'm with you. The doctor already explained to me this condition, but I'm just asking why is it so important that I inject insulin every day and many times per day?
I appreciate your concern. And as long as this important protein for controlling your blood sugar, in absence of this protein and absence of this drug we are giving to you, you will have persistent elevation of this blood glucose in your body, and by the time can cause many serious problem to other organs because of increasing this level too much for too much time. You are with me, Miss Devi?
Yes, yes, I'm with you.
This when this persistent increase of your blood sugar, by the time can affect your blood channel in your heart, can cause some heart attacks. Sorry for telling you this. Can affect also your kidney function. Can also affect your blood vessel in the chain and sometimes causing some clots. Sorry for telling you that, but this is very important to tell you to know how much important this medication you are giving to you. You are with me, Miss Bibi?
Yes, yes, I'm following you, doctor. Doctor, I understand this, but doctor, to be honest, I'll be honest with you, it's very hard for me to inject myself using this needle. I'm very sensitive about this, but I need to be honest with you. I don't like the needles. I think I have phobia from these needles. So
Yes, okay, I am hearing you.
yes, I just told you that I have phobia from these needles. I get very scared when I try to inject myself. So sometimes I am successful. I do inject myself, but sometimes I spend hours and hours convincing myself to inject this needle, but I can't. So I don't take all of the doses as required.
Your worries is valid, and I appreciate your concern, Ms. Dibi. But we can do some solution for this issue. We can again share our specialized nurse to teach you how to use these needles, and we can use a small pen. There is many new pens available now with very minimum with many small needles, and we can use also some numb cream to not feel this pain. And after with stitching with our nursing, it will be less painful and it will be more comfortable for you. Is it okay for you, Ms. DB?
Yes, but I have another question. Is this if I took the insulin on and off, like I want, like I'm doing now, does this affect me long term?
I appreciate your knowledge, Ms. Dibi, but honestly, it is very important to maintain your blood sugar at near the normal level as all guidelines, because fluctuation of this level it is more harmful to other organs and to the blood channel in your body. So it's very important to take it regularly on the doses that adjusted by our gland doctor to maintain this blood sugar in the safe level. You are with me, Miss Debbie?
Yes, doctor, I'm with you, but I really don't like the needles. If there is any other options, can I take insulin tablet, for example, or any other medication? I don't like the needle.
I am sorry for your words, Miss DB, but unfortunately, no available insulin tablet in the market nowadays. We hope many researchers doing for that, but for now, not available. And as I mentioned before, your condition is totally absence of insulin, this precious protein in your body. So it is very important to use this insulin and to follow the adjusted doses by the gland doctor in the optimum and accurate time to avoid this fluctuation, because we have some feedback from your blood sugar monitoring that you have a very low blood sugar, and very high blood sugar. This means, as you mentioned, you are taking it in different times. You are with me, Miss DP?
Yes, yes, but but I make up for that. When I lose the dose, in the next dose, I take it double to make up for the lost dose. Is that
Yes.
good, right?
Yes, I appreciate your knowledge, but this can cause suddenly decreasing your blood sugar, and this is also very harmful for you because if the blood sugar because more become more low, it can affect, it can cause a change of your conscious level, and it can up to you maybe lose your conscious, and this very maybe very harmful for you and maybe affect your life. Sorry for telling you this. So it's very important to take it on the regular
2 minutes
time.
left.
Okay,
Okay,
Miss.
doctor. Okay, doctor.
Any other concerns, Libby?
No, doctor, that's it.
Okay. For now, Ms. DB, I need to ask you about your lifestyle and your diet. How is this?
I'm trying to control my diet, but it's hard for me to shift my life suddenly.
Okay, we are here. Our patient is here. We can help you and give you the accurate information about the diet and the exercise and how to cope with the new this new medication and new condition. Okay.
Okay, doctor.
I will ask some question, Ms. Bibi. What about your job?
I'm a teacher, doctor.
It is affected by this?
Yes, because I have to inject myself in school and I have to eat some specific food.
Mm. Sorry for that, Ms. DB. We have some solution also for this. You can adjust your food before you go to job and they take your adjusted dose before you go there. Or in your work, you can take a separate room and they take it there. And with good monitoring of the glucose, there is now smart watches and many new techniques to monitor your glucose closely. Okay.
Okay, doctor.
Smoking, Miss DB?
No,
Any alcohol?
no.
Miss DB. For now, I will give you some brochure for regarding the diabetes and how to deal with it. And I will give you my hospital number for any more information. Okay.
Okay, doctor.
Any support at home you need, Miss DB?
What?
Any support at home you need? With
No,
whom you are living, Miss DB?
I live with my partner.
Okay, Ms. DB. Better to tell him about this and about the some if any change in your conscious level or any sweating or any shaking in your body or كده, to tell him about your to have this to know that you have this diabetes to can help you all the time. Okay.
Okay, doctor.
Any other
Okay.
concerns, DB?
No, doctor.
Thank you.
Yeah, time is up. I add 1 minute for the last concern. Any concern, Dr. Kotov, you want to add?
No, no. That's
Okay,
it.
so you can comment now, please.
Okay. Regarding this patient, you did address my concerns, all of them, very well. But one of the most important thing I wished you added that this patient clearly needs psychological support because she just had a shocking new diagnosis that can change her life completely, and she has phobia from the needles, as she mentioned many times. So I think she really need any psychological support either from her family members or from a therapist, for example. So you should offer for her some psychological support. Okay, and that's it. But sometimes you give chunk of information without checking with the patient. But I need you to do that more often to do chunk and check with the patient. That's it.
Okay.
Okay, thank
And
you,
you didn't
Dr.
do the
Kotov.
summary. Sorry, I didn't do the summary at the end.
Actually, if no time, no need to do the summary. It's not
Okay.
necessarily to do the summary in every case. Sometimes the concerns will fill the time, and you will not
Mm.
have the time to summarize or to ask the patient to recap.
Yes, that's right.
But
This patient had too many concerns.
yeah, so my comment about driving. Did he ask about driving?
No.
So it's important as this patient having recurrent or erratic lifestyle of the blood sugar up and down. She might have hypoglycemia while driving, right?
Yes.
Whenever you are asking about the social, Dr. Muhammad, you have to consider driving cessation
Yes.
or hold in
I
this
write it in
scenario.
my paper, but I forget to mention it.
As usual, yes. I hope the examiner will read our papers. You know, if they will read the paper we prepared and the scheme you are preparing, they
Mm,
might give you good mark.
yes, yes,
Why?
you're
Really?
right.
No, no, I hope, but if
I
not,
know.
I hope. Because you are writing many things, but when you do the performance, it will be totally different. You got it?
That's true. Yes.
Yeah. So you'll not have the time to fill up all this scheme or the approach or the point you mentioned.
Right.
Yeah.
Right, Dr. Bakr. It was very important to mention driving,
Yes. Yeah.
but I mentioned at the end, يعني something regarding the hypoglycemia to be protected by another person to know like this, but I didn't add the
It's
driving side.
sometimes no excuse. They always like to ask about the hidden point, which is very serious to the patient. You address the alcohol and smoking. You address the device, which is subcutaneous insulin pump. You address it, right? You mention it.
I mentioned many devices available to monitor your glucose,
Okay, this is CGM, continuous glucose monitoring, right?
but
Connected to
he
the
didn't.
phone.
But they didn't mention insulin pump, Dr. Basim. I can't
Yes, I
mention.
know, I know. It's not the task here. But if she reached to this level of the discussion, you can tell her. She might tell you, doctor, any other option for me. Put it in your mind. I am not saying you have to mention it here, but I am saying it could be a solution for those people who's having phobia from self-injection. And the good thing you mentioned here, the pen. The pen is not a needle. It's a like prick. Okay, she's worried about the needle itself, which is mixed insulin. You know how to put it under the skin. But nowadays the pen is very easy. It's just a prick, right? Very minimal or small or minute needle or pen. You can inject. Just you will feel the prick, so you'll never feel or have fear of injecting or pushing something. Okay. These are the most important points. So the pen, and while you are explaining diabetes, please mention type 1 because this patient is young and she's having type 1. So
I
type
explained
1,
type 1, but I didn't mention type 1.
exactly, yes. I heard you saying you have diabetes and you have defect in protein called insulin, but it's type 1. Why this
Yes.
patient need insulin? Because she's type 1.
I
However,
waited, Dr. Basim, when she mentioned give me tablet. At this time, I should tell her you have this type 1.
exactly,
Don't from the
yes.
other. Yes.
See, it's linked together. Whenever you are starting to explain or to counsel, you will find the things like this. Type 1, you have no insulin in your pancreas. The pancreas is a gland in your tummy which is controlling the protein called insulin, and the insulin controlling your blood sugar not to be high. For you, it's very necessary and vital to have insulin from outside and continuous explaining. Okay? So this is the way how to explain. This is the way how to address the needle phobia by injecting, not injection. You will prick yourself with a pen with very small pin. So pen is the tool itself, but from the pen there is a small pin will get out and prick your skin and putting the insulin inside or under the skin without feeling you are injecting yourself.
We
So
can add, Dr. Basim, you will not see the needle. You will not see the needle in the vein.
exactly. You cannot see it. It's
Yes.
just prick.
Yes.
Then it's done. You will not have any fear from this prick because it's very fast and very very minimal pain. Not like the needle itself or the injection. Okay. The social, smoking, alcohol, and driving is very important. And the complication you mentioned, eye, the nerves, the kidney. Okay. The last thing is don't inform my partner, right? She's saying like that.
No, 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 no. I told her with whom you live, best only to have some support for her if he has any critical symptoms like hypoglycemic attack or like
Yes.
this. I told her you should inform him to be beside you and tell him about the symptoms. If you have it, he can help you at this time by some sugar like this.
Perfect. It's one of the point in the counseling about diabetes and low blood sugar or hypoglycemia to inform not only the family, even the friends. You can inform your friends about your diabetes, closely friends particularly. Why? Because if you have this attack while you are with them, they can help you, they can save your life. Maybe it can create your life, and they can save your life by putting some sugary diet in your in your tummy, sorry, in your mouth, and by this way they can save your life. Okay. Anything else, Dr. Kotov? CGM is very important to mention. It's particularly type 1. CGM, one of the very important and intelligent magic modes or tools. It can alarm you whenever you have any low or high blood sugar. So whenever you are exceeding or down below the alarming level of hypo, it will alarm you through your phone. It will be connected to your phone, and the phone will alarm you that your blood sugar is going down. And it's continuously managing and measuring your blood sugar. Okay. Any other comments?
No, doctor, that's it. But doctor, I'm just asking if he should explain the disease again at first. I think that he took some time to explain the diabetes again. But this patient already been diagnosed with diabetes. The disease was explained, and she was taught to use the needles for insulin.
Can I
So,
answer the question for you, please?
Yes.
Okay. Many monitors told that better to put background for the patient, even he know everything, to make a background for you, to tell him this is as we explained, you don't have this insulin, you should have this to do to this. If you don't know this, maybe he, يعني why he is not following the instruction, because he didn't know everything, and he didn't maybe didn't understand. So why he is not following the instruction if he's informed very well about the complication, about the technique, about how to be how to avoid this painful injection like this. This is what I know. Waiting for Dr. Basim. So the better for yeah, what I informed that better to do at least some background and update the
Yes.
patient for at least one yeah, a few seconds at least. Tell him.
What I realized from the feedbacks, they like to give seriousness background to the patient. What will happen if you didn't do this? What will happen if you do this? That, okay? Why? Because means you are either convincing the patient, not confronting. You are convincing the patient for the medication or procedure or surgery. If you couldn't convince him, means that failed. You are failed, right? So the best way, as Dr. Muhammad said, you can ask her initially, do you want me to explain about the disease? If she said no, you can skip to the next point, which is the complication. Here, the most important is the complication. Suppose the surrogate will tell the candidate, I know about diabetes, but here you have to explain about the diabetic or poorly controlled diabetes complication. Got it, Dr. Gotov?
yeah, this is what I mean. That
Yes.
if he asked that, do I know enough about the diabetes or so, I could have said yes, because this is what is wrote in the surrogate paper. That you
Yes,
already know about your disease, you already know about how to inject yourself, but you are afraid about the needles and the lifestyle changes of the diabetes.
exactly.
Yes,
So,
so this is the bulk of the communication.
yes. So it's a matter of how to convince about what she should do in the future.
Yes,
Diabetes itself, she knows.
yes. That's
You
why he
might,
first
yeah,
he can ask me if you need further explanation.
exactly.
No,
Yeah,
I would have just said no, and he would have saved like 1 minute or 1 minute and a half.
yeah. It will save 1 minute and a half.
Mm.
So this 1 minute and a half, you'll explain what the complication of your lifestyle, what you are
Yes,
doing now, is very dangerous. Why, doctor? You might lose your vision. You might lose your kidney. You might lose your nerves. This is the most important. Plus stroke, mini stroke, heart attack. As we know, all of us, the micro and macro complication. You have to give idea about them and let the patient have the seriousness of this complication. Okay.
okay.
Yeah. So I will post you your scenario. Just give me a second. Anyone want to comment before moving to the next scenario?
Doctor, just give me a minute, okay?
Yes, sure. So Muhammad, the picture is uh, summarized in asthma, right? Asthma patient, difficult to control.
Yes, asthma patient, difficult to control, patient unhappy from the treatment for the treatment.
Yes, okay.
But better يعني she can يعني make the picture more wide, it will be a little more clear يعني better to read because it will
Okay,
help her.
I will share both. This is the summary.
Share both to help her.
Okay, and this is the scenario itself. Wait, give me a second. So all of you can read and practice on this scenario later on. However, it's not that much clear. Okay, this is the second scenario in details. Mr. Ali, 38 years old, patient developed mild asthma around the age of 10. This was managed with occasional salbutamol to treat symptoms when he had a cold or after exercise. He is an only child and still lives with the parents. Nobody in the house smokes and there are no pets. His asthma has become more persistent over the past year. He has symptoms every day with frequent attacks of wheezing, dyspnea, and cough. He often experiences night waking because of his cough and has chest tightness and feels breathless following moderate exercise. The reason for his increase in asthma severity is unclear, and no specific triggers are obvious. He was treated with an inhaled steroid, but it caused his voice to become hoarse and interfered with his singing. He was also He was also concerned that the steroid would cause weight gain if he persisted using it. Now he refused to try inhaled steroid treatment again. He bought a nebulizer and takes nebulized salbutamol up to 4 times each day. He has had short courses of oral prednisolone, which settled asthma completely and very quickly. He was treated with oral leukotriene receptor antagonist, but the response was not satisfactory. Your task to explain the management of the patient asthma. Okay, Dr. Button?
Yes, doctor, I will just prepare the case.
Okay, take your time. Just let me know when you are ready.
Okay. Yes, doctor, I think we can start.
You ready, doctor?
Yes, inshallah.
Yes, let's start. Here you go.
Okay. Hello, my name is Dr. Abdussalam. I'm one of the doctors in the service today. Are you Mr. Ali?
Yes, doctor, I am Mr. Ali.
You're 38 years old, right?
Right.
So, Mr. Ali, I'm here today to talk about your treatment for your asthma. Is that okay with you?
Yes, doctor.
Do you want us to wait for anyone else while to discuss this condition?
No, I am ready.
Okay, that's great. So, Mr. Ali, could you please tell me how much do you know about your condition so far?
Yes, doctor, this ugly asthma, it is distracting my life. I am not happy in my life because of this asthma. Please, I need help.
I'm really sorry for your struggling, Mr. Ali. We will try our best to help you. So, Mr. Ali, I understand that you have been struggling recently with the medications. Is that right?
Yes, doctor, yes, this what's called the steroid inhaler, this one, after I use it, I feel my sound changed, and I am a singer, and this my favorite hobbies. It will be affected, so I need to stop it.
That's really a valid concern, and I'm really sorry for that. But from what I read from your file, I understand that recently, in the recent year, your asthma has exacerbated so much and it became nearly every day, right?
Yes, doctora, come horrible.
It's even affecting the quality of your life. Is that right?
Yes, you are right.
Okay, I'm really sorry for that. So, because of this persistent asthma now, we have to take serious measures in order to control it. So we might need to escalate our treatment to higher levels, like steroids, as you know.
Hey, doctora, but as I mentioned to you, I am a singer, doctora, and it will affect my hobbies, and this will be more upset, and my mood will.
Yes, I really understand where you're coming from. And this is really a difficult situation to be in. But even if you don't take this inhaled corticosteroids, the asthma itself is going to affect your hobbies and it's going to affect the quality of your life. So if you take these medications, it will have a great impact in your life. Are you following me so far?
Yes, doctora, but I can use this blue one. It is very nice one. I used it last week. My sound didn't change, and I was okay. So my hobbies is going well.
Yes, I understand that. Of course, this blue one, it really help your symptoms, but it's only temporary relief. It's only for the short term, and it will not affect the persistence of your symptoms. It will not change that you are having these night symptoms and intolerance to exercise. I understand now. If even if you do any moderate exercise, you will feel really short of breath. Is that right? So this type of medication will not help the quality of your life. It will just relieve you temporary, and it can also cause some toxicity if you take too many doses per day. Like for now, you are taking 4 times or more. Is that right?
Doctora,
Are you
take it
following
more.
me?
Yes, I am with you.
Yes. So I just would like we discussed now. This blue one is just for temporary relief, and too many doses of it can affect your health and can cause toxicity.
There is one medication I took before for a period of time, oral steroid. I take this steroid through oral. Also didn't affect my voice, and it was very nice days that was using. What about it?
Yes, oral steroids are one of the options, of course, but we usually go to the oral steroids as one of the last resorts because toxic. This oral steroids has many side effects and can affect your health in many different ways. So we usually prefer to use the steroids locally because this inhaler that causing her hardness of voice for you is the same medicine that in you take tablet, but this one, when you take it locally through the lung as inhaler, it can never have a very severe side effect in your body.
So,
Uh,
Doctora, what I will do now? Also, I heard about one medication called leukotrienes, and they give it also to me. It was not so good, but at least it will be better than this inhale. What about it?
Yes, I really appreciate your concern. I understand that. But you already tried. We tried before this leukotriene receptor antagonist, but it didn't show any promising results with you, and it didn't improve your symptoms or your condition at all. So I don't think it's an option here. You used to take it regularly, right? You're compliant on it.
Yes, I take it for a long time, and it was not the best one, but at least it make me enjoying my hobbies.
Yes, I understand really where you're coming from. But it was making you enjoy your hobbies, but it wasn't helping your asthma. That's why you didn't continue on it.
Yes, you are right, Doctor. Yes.
Yes. So now we have some options. As I said, we can use the inhaled corticosteroids, the one that you didn't like. If we can solve this problem of hoarseness of voice, or we can go to the oral steroids. I mean, by mouth, the tablet you take by mouth. But this one also has its own side effects, and it's very toxic side effects in comparison with the inhaled one.
Okay, Doctor, I will think about that. Then I will decide and tell you.
Okay, so I just want to tell you some of the few side effects of the tablet you can take. It can cause some weight gain. It can increase your blood pressure. It can increase your blood sugar. It can cause some thinning of the skin and make you more susceptible for infection. But it can help your asthma. That's why we can give it to you. We used to give it to asthma patients like short terms. We don't go there unless there is no other option for us. Is that
Okay,
clear?
I will think about that.
Okay, that's good. So for now, Mr. Ali, I just want to ask you a few questions. There is no one in your home smoke, right?
No, Doctora, all the instruction regarding the clothing increase, like bit smoking, all this, no one there.
Not even one of your friends or the
No good
people you
answer,
spend.
Doctor, regarding this.
Okay. Do you have any pets at your home?
No, Doctora, I mentioned for you, no pets, no smoking, all this, no.
No, any new trees or plants?
No,
No. So what's your job? Have you changed your job recently?
no, I am firefighter.
You are a firefighter. You don't you exposed to the fumes often?
No, no, I am working since years in this. I not exposing. I am office there.
Okay, I'm really sorry for what you're going through. And how much does this impact your life?
Yes, Doctora, every time I have these attacks, I take sick leave and sit at home. It may be affect my job.
Okay, I'm really sorry for that. We will try our best to help you, and I can also refer you to the occupational health therapist and to the psychotherapist to help you with that.
Thank you, Doctora. Thank you.
Thank you. So, regarding the medication, as
Two
I
minutes
discussed
left.
with you, Mr. Ali, do you have any other concerns?
Okay, Doctora. That now I will think about this options and I will tell you again. And I need one report for my job to support me if I need sick leave for this. Only this my concern.
Yes, that's great. Of course, we can offer you with a report to your job. We will detail everything and give you some sick leave for now, okay?
Okay, thank you, Doctor. Thank you.
Okay, nice to meet you, Mr. Ali. So today we talked about your asthma and how can we manage it because it's been unmanageable recently. We talked about the inhaled steroids and we talked about the tablet steroids as well. And I explained to you the benefits and the risk of each of them. So we will arrange another meeting, including our seniors as well, and we will help you more to decide which one is more suitable for you. Is that okay with you, Mr. Ali?
Thank you, Doctor. Thank you.
Okay, so Mr. Ali, if you feel any shortness of breath, if you can't breathe, or you developed any severe attack of asthma, I advise you to come to the hospital immediately. Okay, and I will give you some brochures and website to read about the medications and your condition more. Okay,
Okay, doctor. Thank you.
thank you very much, Dr. Ali. Mr. Ali, I hope you speedy recovery.
Okay, time is up. You can comment now, Dr. Muhammad.
دكتورة, she did يعني it very good, but I will revise it as other revising and some comment, little comment. As we mentioned in the last scenario also, better to explain for the patient what's mean asthma and what is the role of inhaler, because this he has he don't know what is different before this inhaler. What is the role of it's clear that he don't know that the blue is causing dilatation or decreasing the narrowing of the airway. You can draw for him the airway, and we have
Okay.
the asthma have two ways to attack you, by narrowing the airway or soreness of the airway. This blue one, it will prevent the narrowing for a while, and you will feel better for a while. That's why you feeling this improvement for a while. But the other one, this is very important. It will prevent this soreness. So at the long term, it will help you to be more better and more comfortable in your life. It will take less than 1 minute. He will be now understand what is the different, why this important. This is the first one.
Okay.
Second thing, when he tells you, I am taking this inhaler, you didn't check how's you are, yeah, you didn't check. Uh, um, uh, 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 we can help
The
you.
technique.
Help you. Yes. This you better to do some gargling your mouth very well. It will prevent this voice change. We can you offer him for a spacer. It will be also I think better, yeah. And we can refer you again to the nursing specialized nurse for this to teach you more better to prevent this side effects.
Yes, I
Uh,
wrote this as well, but I forgot to mention it.
Better. Yeah, we are here revising. It is not
Yeah,
a
I know.
forgetting and all of us mistake. When we bring a case, I mentioned for Dr. Bassel, better everyone he will bring a case, he should be very sure, very yeah, revising it well, tested it before, and know where is the gaps and where is the defect to help the other to not have it again. So that's why we are revising. It is not wallahi better. يعني, as Dr. Bassel mentioned, usually better here to mistake, not in the exam, because
Yes,
exam
yes,
you have.
sure.
Then he will ask you who he told you about the steroid, and he was very happy. Yes, you address it really very nice. But يعني you were late for the mention the adverse effect. على طول directly tell him this is the last option as you mentioned, and we are using it for a short term because of it is a very serious drug, and when we take it long time, it will affect other like you may be overweight and blood pressure high, high. As you mentioned, you are mentioned very nice, but you make some gap between when he told you about it, you address it later about the toxicity, and this is very important. The seriousness in the communication regarding non-compliance, this is the clue for the case. Any patient is not compliant, not happy, على طول, this is very serious for you to not take this. Why? Because this is or the medication he want, if there is seriousness, this is very serious to take because of this. But as you mentioned, you address it well, but only some gap.
Okay.
The third thing, leukotriene, as you mentioned, you take it before and it was not satisfactory result, and you experienced it before. And you can add also one statement for this. And this medication, it will not work alone as per guidelines. It needs also support by this inhaler to make an effect to be more better for you. Uh, social, seriousness, social, okay, and ask it about job. asked about the support. طبعا regarding the triggers he mentioned in the scenario all trigger to stop يعني to help you to not mention the trigger. Already he mentioned he يعني following all the avoiding all the triggers يعني. And
Okay.
firefighter يعني you were very nice question how much affect you and this is why the question of how much affect you it's very important because many candidates before and I am one of them when as a firefighter I will give you report to allocate your position and the 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 asthma will be affected too much and you will make him خلاص horrible to not go his job. No, the best question how much affect he will tell you I since years I'm in this job doctor I am very nice nothing the job not for me your work your supposing to the smokes no I am office خلاص finish I will give you some report if you need any time to give to your occupational health worker if you need any help. Okay, thank you, Doctora. You did very nice. Thank you.
Okay, thank you very much, doctor.
Okay, thank you, Dr. Muhammad, for the case and the comment. My comment, adding to Dr. Muhammad point, only when you ask about the pets and the plants, why you are asking if it's already mentioned, as Dr. Muhammad said to you, it's already
Okay.
mentioned in this scenario. Means either you are not focusing in the reading, or you are doubting about this data, which both of them are might harm your mark. So the best way is to trust your scenario. If meta written for you no pet, no need to ask. It means that no pet. Any plans, no plans. What you should address here, as Dr. Muhammad addressed also, the technique. And you already mentioned it. You wrote it in your paper. How you are using. Do you use it in proper way? Any one of our specialized nurse inform you and educate you how to do it in a proper way. Sometimes the technique itself either will lead to flare or a worsening of your asthma or no response. Not
Okay.
only that, you might have the side effect of the medicine. So you are not taking the benefit. Instead of that, you are having the side effect. One of them, the hoarseness of voice. If you are not doing the gurgling by the water after using and before, mainly after, and the spacer itself, if you are not using it, also it can lead to what you already have, the hoarseness of voice. The side effect of steroid as any medication, it can happen, but for inhaler, it will more less or it would be very minimal compared to the steroid as oral or injection. So there is possibility to have side effect of steroid, yes, but it's very minimal compared to other route, oral or injection. So
Okay.
please, it's very important. It's the cornerstone, as Dr. Muhammad said, the cornerstone of asthma. Steroid should be.
Okay, doctor.
Bassem, can I
Are you up?
correct? I
Yeah.
remember something also. Also,
Yes.
Doctora, when you mentioned when he can increase blue one, you mentioned that it will improve you temporarily and by increasing it will be more toxic. But you didn't mention for him what is the toxicity. He should know what is it. يعني he should cause some heart racing, some shaking with your hand. At the end, your body salt, what we mean potassium, it will be low and maybe cause very risky heart beating for you. يعني you mentioned for everyone the toxic, it is toxic, but you delayed or you didn't show for him what is the problem from this increasing to be away from this. And the other
Oh,
thing, the seriousness of not following the instruction in using this inhaler, in using this, you didn't also mention that if طبعا you will not confront him, but when he tell you خلاص دكتورة I will think about that, or at the beginning when he is refusing or struggling to use the inhaler, and you are explaining the disease itself. That's why without using these inhalers, you may have serious attacks of this asthma and maybe fatal. So at this time, he will be think again that this is very important. Okay.
okay, okay, doctor.
Yes. The other point I wanted to mention here, about yes, the guidelines, the new update about the asthma control. No more short-acting beta agonists, as you know. Are you aware about the update,
Yes,
Dr.
yes. على طول inhale the steroid from the beginning, then
Exactly.
inhale it.
Yeah. So you will start with the long-acting formoterol from the beginning, plus mild dose or low dose inhaled corticosteroid. No more short-acting beta agonists in between attacks or PRN. So the steroid is cornerstone now for asthma patient from the start. No more waiting to be having more attacks overnight, coughing overnight. No, they are starting it from the start, from the beginning of the diagnosis. This is asthma patient. He should start on long-acting beta agonist along with inhaled corticosteroid. Low dose, they can increase the dose to moderate. If he has no response, then they can refer according. If there is eosinophilia, they can give monoclonal or biological therapy. If there is no eosinophilia, they can increase the dose more to high dose of an inhaled corticosteroid. If no response, they can consider leukotriene receptor antagonist and so on. So my concept is whenever you have asthma, you have to start inhaled corticosteroid. Okay.
Okay, okay.
So the patient should be convinced as you did at the end, and please ask him at the end how is your opinion now? How do you think about this inhaled steroid now? Are you agree to take the medication? It's not the formal consent. No, it's verbal consent and impression. How is your impression about this medication now? Okay. If he's
Okay.
you mean it means that you pass the case. If he's still insisting and resistant, no doctor, I don't want, and means there is something wrong. But instead of recapping or summarizing, you can ask him what else, why you are not agree after all this 8 minutes, for example, why you are still having any doubt about it. Okay.
Mm, okay.
Okay, perfect. Dr. Kotov and Dr. Muhammad, anyone has comment or question? Both of you first, Dr. Muhammad and Dr. Kotov.
No, doctor.
Anyone else
Thank
in the...
you.
Yeah, thank you, Dr. Kotov. Anyone want to add any comment or ask any question regarding both scenarios? Asthma counseling and the previous one for diabetes type 1. The trending scenarios nowadays, diabetes, non-compliant to diabetes, or diabetic patient with morbid obesity, body mass index is high, and the patient is requesting to do bariatric surgery. This is new trending scenario. Be sure that you did this scenario or you train on it. Is it clear for all? Anyone want to add any comment? So clear. Satisfied all? So we'll see you inshallah next week with the short station. So next week will be long communication and short clinical. Have a nice weekend. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
You, Professor. Thank you.
Thank
Thank
you,
you.
Dr. Bassem.
Most welcome.